Assalamualaikum warahmatullahi wabarakatuh and a very good day. Today, our lecture today will be the introduction to the course. So we will have an overview on the pharmaceutical stability. So as a pharmacist, we have been taught about the importance of ensuring ensuring the stability of pharmaceuticals. So we know that there are several factors that may influence the stability of pharmaceuticals, but in the practice, how well do we observe these factors that may influence the pharmaceutical product? So in this short course, we will have a brief overview on these factors and see some examples on the pharmaceutical instability that might occur. In this short introduction course, we will have a quick overview on why stability is important for pharmaceuticals, what are the factors that influence the stability of pharmaceuticals, and some examples on instability problems associated with pharmaceutical products. So why stability is important? We have to go back to the definition of stability of pharmaceuticals. So what does it mean by stability? It means that a product can sustain or can retain the characteristics of the product to ensure that the content of the product is pure, safe to be consumed, efficacious to the consumers, and prevent any toxic effect that might develop from degradation of the active ingredient or the excipient that is present in the product. So this is why it is very important to observe the stability of pharmaceuticals, because as we already know, a pharmaceutical product contains an active ingredient that is used to treat or for certain medical condition. So if this active ingredient degraded, so the product is not useful anymore. So that's why we have to pay attention and to take care and protect our products from specific factors that may cause degradation of the product. So as a pharmacist, we have to know the threat that may degrade our pharmaceutical product. So we have numerous products in the market. So that's why we have to be very careful and to know exactly what are the factors that may degrade, or what are the factors that we should protect our products against. Okay, there are many factors that may influence the stability of pharmaceuticals, and among the most common are temperature, pH, moisture, light, and oxygen molecule. So these are the most common factors. There are many other factors that may influence the stability of pharmaceuticals. So these factors are common factors that are present around us in the storage condition, or in the storage condition at the hospital, at the clinic, at the pharmacy, or even at patient's home. So we have to make sure that if we dispense a temperature-sensitive product to a patient, we have to remind them about the importance of keeping this product at the right temperature. Bear in mind that our country, Malaysia, has a very hot and humid environment. So we have to know exactly which temperature is the best for our products. We have to know what will happen if the product is stored at room temperature, at our room temperature. As an example, products such as insulin that need to be stored in the fridge. We have to remind the patient to put in the fridge, and we have to put a proper label on the box to remind the patient that this should be stored in the fridge. So let us see on some examples on stability of pharmaceuticals. So as a pharmacist, we should be able to recognize immediately any instability that occurred to our pharmaceutical product. So it's a skill, and we should know how a product look when it is unstable, and how a product should actually look during storage. So let us look at emulsion. So the product on the left uh, is this is called cracking of emulsion. As you can see, there's a layer of oil at the top, at the topmost part of the emulsion. And on your right, this is a creaming of emulsion. What are the difference between these two problems? Cracking actually means that the oil has separated from the emulsion, forming a layer. These problems could not be reversed or irreversible, and hence this product is not stable anymore. While creaming means that a layer of cream formed at the topmost part of the emulsion, and in this condition, it can be reversed by shaking and by mixing the emulsion well. So if you observe an emulsion with cracking problem, it is not safe anymore and it should be discarded. But creaming can still be saved, and you can mix well to obtain a homogeneous emulsion. Let us see to a second product, which is suspension. These are two examples of suspension. The one on the left is a well-dispersed suspension. You can see that the suspended particles is well dispersed in the media. But at the right side, this one, you can see as sedimented, uh, the particle has sedimented to the bottom of the bottles. This is not a big problem if the sedimented particles can be redispersed again by shaking. But if you shake and the sedimented particle remain as a cake at the bottom of the bottle, it means that this is not stable anymore. So you have to remember, for suspension, a sedimented particles is not a problem if it can be suspended again. So this is an example of um, an ointment. What you can see here are crystals of salicylic acid. So this is actually a product, an ointment that contain LPC and salicylic acid in emulsifying ointment base. As you can see, during storage, the salicylic acids turn into crystals. It forms a layer of crystal at the upper part uh, of the ointment. So when patient receive this product, they receive a product with a concentrated layer of salicylic acid. And if they apply this product on their skin, they will have the concentrated salicylic acid first applied on their skin. Will this be safe? Do you consider this as a safe product to be applied by patients? So these are some of the points that I would like to 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 expose or to discuss in this first introduction course. So we will have a subsequent course on this subject, and thank you very much for your participation in this course. Thank you.